Hi, I'm Pat, and I will be discussing Tetralogy of Fallot. So, a little bit about Tetralogy of Fallot is that it is a congenital heart defect that is characterized by four structural defects. These defects include ventricular septal defect, pulmonary stenosis, aortic displacement, and right ventricular hypertrophy. These structural defects affect the blood flow in the heart and results in poor oxygen being delivered to the rest of the body. It is typically diagnosed during infancy, and it is the most common cyanotic congenital heart condition. So just to get a little better understanding of Tetralogy of Fallot, I just want to highlight a few key structures in the heart. So the aorta is attached to only the left ventricle. The aortic valve opens as the ventricles contract and allows oxygen-rich blood to flow from the heart to the aorta and then to the rest of the body. The pulmonary valve and pulmonary arteries. The valve is located between the right ventricle and the pulmonary arteries. The pulmonary arteries transport deoxygenated blood to the lungs. As the ventricle contracts, the pulmonary valve opens and allows blood to pump from the right ventricle to the pulmonary arteries, and then the valve closes to prevent blood from flowing back into the heart. And the ventricular septum separates the left and the right ventricles, and this prevents deoxygenated and oxygen-rich blood from mixing together. So normal blood circulation of the heart, the deoxygenated blood is circulated back to the heart through the inferior and superior vena cava and flows into the right atrium. The blood then flows from the right atrium to the right ventricle. As the right ventricle contracts, the pulmonary valve opens and blood is sent through the pulmonary arteries through the pulmonary valve. Upon returning from the lungs, the blood is now oxygen-rich and flows through the pulmonary veins to the left atrium. The left atrium then sends the blood into the left ventricle. As the left ventricle contracts, the aortic valve opens and the blood is ejected from the left ventricle into the aorta and into the rest of the heart. So the structure of the heart in Tetralogy of Fallot. So there is a ventricular septal defect. This occurs because there is a hole in the wall of the ventricular septum, and this allows deoxygenated and oxygen-rich blood to mix together. Pulmonary stenosis is the narrowing of pulmonary valve or the vessel before it. The valve is not fully opened, or it may be partially blocked before the valve in the vessel, and this leads to a lack of blood reaching the lungs. Aortic displacement. The aorta sits directly above the ventricular septum defect. The aorta opens from both ventricles instead of just the left ventricle. This allows deoxygenated blood to flow into the aorta instead of only the pulmonary arteries. And then right ventricular hypertrophy. The muscle in the right ventricle is much thicker. This occurs because it must work harder to try and pump the deoxygenated blood through the pulmonary valve and into the pulmonary arteries, and this is a result of pulmonary stenosis. Circulation of blood in Tetralogy of Fallot. So blood is circulated back to the heart via the inferior and superior vena cava and into the right atrium. The right atrium then ejects the blood into the right ventricle. So while the blood is in the right ventricle, the deoxygenated and oxygen-rich blood begin to mix together, and this is because of the ventricular septal defect. When the right ventricle contracts, blood flow is decreased to the pulmonary arteries because of the pulmonary stenosis. This results in less blood getting to the lungs, and then pulmonary stenosis leads to the right ventricle having to work harder, resulting in ventricular hypertrophy. Also, because the aortic valve is enlarged, the aorta is then displaced over the right and left ventricle directly above the ventricular defect, and this results in deoxygenated and oxygen-rich blood being ejected through the aorta during ventricular contraction. And this ultimately leads to less oxygen traveling to the rest of the body. So some signs and symptoms of Tetralogy of Fallot. They can be mild to severe, and it is related to the degree of blood flow obstruction from the right ventricle. Cyanosis is the most common sign. This is a bluish discoloration of the skin, usually around the lips, fingers, and toes, and it's caused by low levels of oxygen in the blood. The infant may also experience difficulty in breathing. They may play for a short period of time and then need a break. They might get short of breath while feeding. You can also hear a heart murmur, kind of a whooshing sound. The infant may become easily fatigued. This can also lead to slow weight gain because they get tired while they're feeding, so they won't eat as much. Clubbing of the fingers and toes. This is a widening or rounding of the skin and bone around the fingers and toes. So if tetralogy of Fallot is severe enough, this can lead to a loss of consciousness. So etiology, risk factors, and demographics. The cause of tetralogy of Fallot is unknown. Could be a result of a change in genes or chromosomes, but it does occur when the baby's heart is being developed during fetal growth. Some risk factors for tetralogy of Fallot: viral illness during pregnancy, alcohol or other teratogens during pregnancy, poor nutrition, if the mother is over the age of 40, diabetes, or if there's a presence of Down syndrome or DeGeorge syndrome. Tetralogy of Fallot is more common in males, and then approximately 1% of newborns have a congenital heart defect at birth, and of this 1%, approximately 10% will have tetralogy of Fallot. According to the CDC, about 1 in every 2,518 babies are born with tetralogy of Fallot in the United States. So some lab and diagnostic tests. A lab test may be performed and could show abnormal increase in red blood cell count. This does not necessarily mean that the infant has tetralogy of Fallot. An echocardiogram uses high-pitched sound waves to produce an image of the heart. This can determine if there is a ventricular septal defect. It can also determine the function of the pulmonary arteries and the pulmonary valve. Can determine the function of the ventricles and the position of the aorta. An electrocardiogram records the heart's electrical activity. This can help determine if the right ventricle is enlarged. A chest X-ray shows the structure of the heart. In tetralogy of Fallot, the heart will appear to be boot-shaped because of the right ventricular hypertrophy, but the size of the heart itself is normal. Oxygen level saturations may also be assessed. This can be assessed by using a pulse oximeter to measure oxygen saturation in the blood, and this usually occurs at the fingers. Cardiac catheterization also determines the structure of the heart, and this assesses blood flow through the heart. So treatments for tetralogy of Fallot. Surgery is really the only effective treatment, and it usually occurs at about 6 months old. If babies are too weak or too small for a complete repair surgery, a temporary surgery may be performed. This allows for time for the baby to grow and become stronger. So during a temporary surgery, the shunt is placed on a large artery that branches off of the aorta, and then the other end is connected to the pulmonary artery. This creates an additional pathway for blood to travel to the lungs, ultimately allowing for more oxygen to become available in the blood. But this shunt is removed when complete surgery takes place. Ultimately, the infant will want to have a complete intracardiac repair. During this procedure, there is a widening or replacement of the pulmonary valve or removal of blockage before the valve. This helps improve blood flow to the lungs, ultimately leading to more oxygen being available in the blood. A patch will be used to cover the hole in the ventricle septal defect, and this will stop the oxygen-rich and deoxygenated blood from mixing together. So then these two repairs will help fix the other two defects. So the right ventricle will no longer have to work as hard, and the right ventricle should return to normal size. Oxygen-rich blood will then be the only blood that flows out of the aorta and into the rest of the body. And then the last side is my references. Thank you.